I'm actually really excited for this odd confluence of Ottawa and California because I'm in Ontario. I don't actually live in Toronto. I live north of the Big Apple, if you know where that is. And our biggest projects are actually in California right now. And so we spend a lot of time going back and forth between California and Ontario. So it seems that's an unusual combination. So kind of seems funny to have found it here as well. So I am hoping today is going to be fairly interactive because that's kind of my style and how I do things. So I am going to do a really quick intro of a few things, introduce you to annotation if you don't know how to use that, so that hopefully we can have some interactivity throughout. There will be lots of times people can ask questions even throughout. So either in the chat, you can come off of mute, or there'll be ways to type on the screen as well if you would like to do that. I totally understand if people want to go off camera, but I also love seeing some faces, so it feels like I'm not alone talking to my own screen. So first, I always like to start by doing a little bit of a land acknowledgement before I jump in. And so I want to acknowledge the land that I am currently living and working on, and the land that I settled on and that I'm located on right now today belong to the Mississauga and the Chippewa Nations, and it is collectively known as the Williams Treaty First Nations and is now called Baltimore, Ontario in Canada. So it's an opportunity for everyone to take a pause and reflect on the land that they are on. And if you would like, you're welcome to add that to the chat. I know sometimes people like to do that. So as Brad introduced, I am from the Center for Implementation. We kind of call ourselves like rogue scientists who left the more academic route to start a social enterprise. And our goal is really to help the people who are responsible for implementing, spreading, and scaling evidence, like evidence-based programs and practices in any field, in any topic area, in any country around the world. And so how can we help these people who are responsible for actually implementing do that in the most evidence-based way possible? So we do a lot of different things. We're kind of known for all of our training. That's what people know us for, but we actually do a lot of these deeper collaborations and partnerships with groups like in California, where we're partnering with the Cal Hope Initiative to implement social emotional learning across 58 counties in the state of California. So it kind of looks a variable depending on what we're doing. But essentially, there is a science of implementation, and we'll talk in a moment about what that is, where researchers are researching what is the best way to implement evidence. And then there's people who are actually like on the ground implementing things. And our goal is to bridge the gap between the science of implementation and the practice of implementation. So how can we bridge those two? Brad already did a little intro. These are some things about me. I am Canadian, but I did my Ph.D. at Penn State down in the States, implementing evidence-based programs. So now I'd love to know a little bit more about you, and I would love to introduce you to the annotation tool. The first thing I would like you to do is, I'm going to clear this and make sure I'm not annotating, ask you a first question, kind of a more fun, and then I'll ask you more of about your work and your research. If you could travel anywhere in the world right now, where would you go? So just take your annotation tool, put it wherever you'd like to go on the screen. Very nice. Literally around the globe. I was going to say not yet Asia, but now we got some Asia in there as well. Every continent but Antarctica looks like it is covered. So people may be feeling eager to travel different places around the world. Now I'm going to ask you a little bit about your area of interest, because when I was prepping for this, I was trying to figure out what would be the topic areas that people are interested in. And it looked like it could be very variable, which is kind of exciting because I am topic agnostic and work with like lots of different fields. So if you could take the text tool, so you know how you had your bar, you picked stamp, now take the text tool. Awesome. So lots of things showing up in a lot of different areas. That seems exciting. Community development and health, positive psychology, healthcare, utilization, collaborative approaches, capacity building, housing and homelessness, community health, youth development, community mental health, social change and justice, health and well-being, interventions and programs, evaluation theory, methods and practice, healthcare. Kind of a very nice diversity across different areas there. Equitable access to education. Excellent. So I'm going to clear those and get into kind of our first topic to talk about, which is about what is, and social innovation through higher education. Health professions, sorry, I jumped too early. Health professions, education, and program evaluation. So the first topic I have is to introduce you, or maybe a refresher, because lots of you might know these topic areas already, about knowledge mobilization, dissemination, and implementation. And I added knowledge mobilization in there because funding agencies like CIHR are using those terms in Canada, not so much used in the United States as much. So if you're in the US, I would focus on the last two. If you're in Canada, I think you need to know all three of them. And the idea is, what are these terms? What is the difference between these key things that kind of get thrown around without really clarifying what they are and what their purpose is? So this is an image that we use to help us disentangle the difference between dissemination and implementation and the science and practice of each. So at one end of the spectrum, because this is a spectrum, there's dissemination. And the practice of dissemination is the act of actually disseminating or sharing information, ideally in a bi-directional way. So when you create a website, when you release a guideline, when you write a book, when you do these different things, we're trying to increase people's awareness and knowledge. So dissemination equals essentially increasing awareness and increasing knowledge. And the practice of dissemination is the act of literally doing that. How are we sharing information to increase people's awareness or knowledge of something? But there are also researchers out there who are studying what are the best ways to disseminate information and knowledge. And those researchers are doing dissemination science. So the science of studying, like asking research questions around what are the best methods to disseminate things. At the other end of the spectrum, we have implementation. And implementation is about using strategies to support people to actually change their behavior to reach some outcome. So it is going beyond just increasing awareness and knowledge, but getting people to actually change their behavior by using strategies. And again, there's a practice of implementation, which is what people are doing out there in the world, right? Like social workers and teachers and people out there in the world are doing the practice of implementation. They're actually implementing new programs every day. And then there's researchers who are sitting around studying, well, what factors predict whether something is sustained? Or what contextual factors matter in terms of whether people will decide to adopt something new? Or what strategies are more effective at getting people to change their behavior? So people asking research questions around how can we actually do the practice of implementation. Ideally, there's bi-directional conversations going back and forth between practice and science. Maybe that's not happening as well as it could, but I think it's hopefully evolving. A note about evaluation is that if you are evaluators, many evaluators are evaluating the practice of dissemination and the practice of implementation. So you're evaluating, hey, is this implementation effort actually working? And that alone is not implementation science. That's like program evaluation or evaluating whether implementation is working, which is slightly different than asking research questions like, what factors predict whether an organization is going to adopt something or not? So that's like a small deviation that we often get when people are doing evaluation, like what's evaluation versus implementation? So with that, I have a little annotation activity to give you a couple examples to kind of disentangle what these might look like. So pull out your annotation toolbar if you closed it. Go back to picking a stamp And I will give you a couple of examples, and you can just stamp on the screen where you think that this lands. So imagine you are working with a team to develop a web page designed to raise awareness about concussion prevention. So you have a website about concussion prevention. Your goal is to raise awareness. What are you doing? The practice of dissemination, the science of dissemination, practice of implementation, or science of implementation? Fabulous. So this is an example of the practice of dissemination. Now, imagine you are now doing a study and you are comparing two different delivery methods for the web page to raise awareness about concussion prevention. What is that? Exactly. So this is now doing a research study, asking research questions about dissemination practice. So it lands down here in this dissemination science bucket. All right, next example. Schools across the state of California are being supported to deliver social emotional learning programs to teachers and students. So this is a project that we're actively working on right now. You are part of a research team, and they're running a study to compare which strategies are more effective in the adoption of these social emotional learning programs. So you're comparing which strategies are more effective. Exactly. So this is an example of implementation science. Now, schools across the state of California are implementing these programs, and you are evaluating if this changes outcomes for kids. Yeah, so this one's a little harder, but I would say that this is implementation practice. It's evaluating implementation practice. The act of literally doing this and evaluating it is evaluating implementation practice. If you add implementation science research questions in there, which often happens, you might be doing both at the same time. But the act of literally evaluating that implementation would land us up here. So thinking about your work, I'd love to know what kinds of initiatives you support, and you might do more than one of them. So like what buckets does your work fall into? Or are you excited to do if you're not yet doing those things today? Fabulous. So lots of implementation practice and science, some dissemination practice, and a tiny bit of dissemination science. A last note about knowledge mobilization. So knowledge mobilization is sometimes described as an umbrella term that includes dissemination and implementation. Sometimes knowledge mobilization is equal to dissemination. The same thing is true for knowledge translation. Sometimes it's used as an umbrella term to mean all of these things, and sometimes it's specific to dissemination. I always tell people it doesn't matter what term you use as long as everyone understands which of these things it is that you are doing. That's what's most important. And so like literally I might change all the words in a presentation to say knowledge mobilization if that's what the group is calling things. But the key is that we're all on the same page about what that really means. So as I mentioned before, kind of now that I covered implementation science and practice, I just wanted to reiterate that our role and to help you understand what I'm going to share today is about how can we make the science of implementation as practical and applicable and relevant and accessible as possible to the people who are actually doing the practice of implementation, because there's not a lot of people out there helping bridge that gap. That's really our role in the system and helps you understand the kinds of information that I share. All right, so I will jump and share. So I don't have a lot of time to explain lots of implementation things. So the thing I thought might be most helpful is to share what we call the implementation pathways. And these are essentially like super high level bird's eye view roadmaps of the key things that need to happen in order to effectively implement, spread, and scale things in the system. And so we really have 4 pathways that we think about as kind of essential to implementing things. The first pathway is often not where people in the field go, but we think is so important and really foundational to all implementation work. And that is what we call the relational pathway. And that's because at its core, no implementation is possible if people do not have relationships. Relationships within teams, relationships often across organizations, across departments within organizations, and that really at their core, there need to be strong, trusting relationships to make any implementation happen. And so this pathway helps people think through kind of how do we actually build those relationships? What does that mean? For example, how are people being convened? How are you bringing people together? Often we have multiple different groups playing very different roles in supporting implementation and evaluating that implementation. So who are those people? How are we going to partner with different groups? What is their role in this system? How are we defining that? What might be the governance structure? So who is leading the team? Who is making decisions? How are those decisions being made? What is the transparency in sharing those decisions? How do people literally work together as a team to actually make the work happen? And then often, because we're often supporting very large scale change initiatives, there's a lot of work happening across the system. So how do we actually work with teams, groups, organizations across the system to support implementation? And although this is not classic implementation science kind of place to go, it is coming out in the literature more and more as really important to implementation work. And that if we don't have those strong foundational relationships, no implementation can really happen. Transitioning to a more technical pathway, we call this the strategies pathway. And it's really based off of several different, very highly established and highly used existing process models, like the knowledge to action and intervention mapping or implementation mapping. And so it helps people really think through kind of the key steps needed in order to design the thing that they want to implement. So oftentimes people come and they show up and they think they're ready to implement, but what they really have is kind of like a practice or a policy, or they have this thing that they think that is ready for implementation, but it's not actually ready for implementation. Because as Brad was mentioning, it doesn't necessarily have a really strong theory of change and a plan on how you're going to support people to actually change their behavior to do this thing. People often have a false assumption that if we just train people, that it's going to change their behavior. We jokingly call it the train and pray approach. But research shows that that's actually not a very effective way to change behavior. And so this helps us think through kind of what do we need to do to unpack and explore that. It starts by getting people to explore the thing. So really understanding needs and gaps. What are the goals? What is the thing that you are implementing? And that leads to really clearly defining who is being asked to do what differently. Oftentimes, people only think about one group of who's that they want to change. So say it's in schools, they're like, oh, well, we want teachers to implement this program. But when you start unpacking it, you realize, oh, I also need principals to do this thing. And I'm going to need support staff to do these things. And I'm going to need paraeducators to do these things. So it's really helping people unpack who is being asked to do what differently. Then understanding and assessing their barriers and facilitators to change. So why are people changing or not changing? We often default to believing that if people knew what they were supposed to do, they would change, but that's not necessarily true. And so when we deeply understand people's true barriers to change, we can then select strategies that support them to change using behavior change theory. And so one thing that's really interesting is, so I am not an evaluator, I am an implementation support practitioner, but we often work with evaluators who play huge roles in unpacking some of these steps. So it is very, very common to partner with evaluators who are doing the needs and gap assessment, or to partner with evaluators who are doing assessments to really deeply understand the barriers and facilitators to change, and then working together with the planning teams to figure out, okay, what are they now? Once people know what they're implementing, then we move on to what we call the implementation spread and scale pathway. This one, oh, I forgot to mention something super important. I started with relationships because none of this work is possible. Literally none of it is possible if you don't have strong, trusting relationships. And so that is why we always, always, always like to start there. The implementation spread and scale pathway is much less linear because there is no consistent order to how this plays out. But essentially, there are different things that need to happen simultaneously or sometimes in a specific order, but not always the same order, about how we actually implement spread and scale things. So we need to identify and build support systems. So implementation teams locally, sometimes central implementation teams that are helping people actually implement this thing. It's really important to assess readiness and context. For example, we know that 70% of implementation efforts fail if sites are not ready for implementation. And so there's a huge opportunity to have really good readiness assessments and context assessments that can feed back into those implementation plans, in fact, directly into these implementation plans, and that can inform plans for not only implementation, but sometimes the need to adapt things and to plan for sustainability. Because research shows that if people plan for sustainability early and they talk about it often, they are in fact more likely to sustain things. So starting that sustainability planning right from the beginning. It's then also really important to operationalize those plans and embed things like pulse checks and monitoring and tracking, like looking at fidelity. Are people implementing things the way they were intended? And to embed evaluation throughout this process, especially making sure that it's not something that happens at the end. Sometimes we see that where people are implementing and then like at the end want evaluators to come in and see if it worked. But really, this has to be brought in right from the beginning. And so that everything is kind of built out that way. So this is what we call the implementation spread and scale pathway. And the fourth pathway we use to kind of help bird's eye view disentangle all the pieces that need to happen is to really think about equity. And so we spent a lot of time 2 years ago delving into how we can embed equity into literally every single step of every single one of those pathways. And what kinds of questions do we need to be asking ourselves and the team in order to effectively do that? And so there's a link at the bottom here. If you want to get access to all those questions, we have a free event and a long list of equity questions that people can ask there. And essentially we went through and looked at every single pathway and what were the questions that they could ask. But you'll notice that these equity questions are part of what we call the equity iceberg. And that often when we're thinking about equity, we think about equity in terms of the actions we're taking, sometimes in terms of the relationships that we have. But really, in order to truly address equity, we need to be getting deeper and thinking about the systems and structures that exist and have set things up to be this way, and about the mental models that different people hold, their values, their beliefs, and their worldviews. And another way that we look at the equity iceberg is thinking about both the process and the outcomes. So we can ask ourselves process and outcome type questions. And one of the things we've often found when people are doing equity work is they're often focusing on one, but not necessarily both of these. And in fact, we think it's a huge opportunity for evaluators to help push the envelope when they're evaluating to show people, hey, we should be looking at equity in terms of the process and equity in terms of the outcomes. So how are we demonstrating equity in our tasks? How do we demonstrate equity in our interactions with others? How are we demonstrating equity within our institutions, our policies, our organizations? And how do we understand and approach the world in an equitable and just way, which are all process questions we're asking, so that we can then look at, have we fostered more equitable conditions? And are we making strides towards establishing fairness and justice? So really disentangling what it looks like to embed equity throughout implementation. So one thing that I like to do when we're thinking through these, because there's so many different components, is to, actually, maybe I'll pick two of these. This one's really, really relevant. Pull out the stamp tool again and put a heart related to things that you have seen as strengths on any initiative you've worked on, right? So it remains totally anonymous. You don't tell us what initiative it is. What have been strengths that you have seen? So say you are like, oh, people are really great at doing needs and gaps. You can put a heart over here. And which aspects have you found are challenges in the initiatives that you have worked on, supported, seen? Awesome. So I'm seeing something that we see often, I would say, is that the first half is kind of where people are most comfortable. Lots of the projects that we support, and I imagine lots of the projects you support, are pretty good at these upfront pieces and are pretty comfortable in that space. But some of these pieces, like using theory, developing plans, looks like strategic planning, engagement, have maybe been bigger challenges or opportunities for growth in some of those projects. I will do one more, maybe jumping to the equity iceberg. So thinking about some of the work that you have seen, where do you think are some of the areas that have been strengths, and where do you think some of the where have you seen some challenges? Awesome. So lots of parts coming up here in actions and relationships, but kind of a lot more question marks the further down the iceberg we go. So I will clear this and jump us to the last part that I have, which is highlighting a couple of common implementation science frameworks that you might come across or might want to use depending on different contexts. And so the way that I'll share them is, so I'm not going to go into them in detail, but I'll share them at a high level, and I can share links afterwards if you want links to the articles, although many of these are so common that there are many, many, many different published articles on them. And so you're sometimes better off searching for articles that seem relevant to your own work because they've been published on so often. And so one of the reasons I presented these pathways at the beginning is because I think it helps us understand where we might pull in different theories and frameworks into the implementation work. So in the strategies pathway, one of the most important things that people need to have, they must have a theory of change in order to select the strategies that they're using. So they identify these barriers and facilitators, and we then want them to map them to a behavior change theory and then use that to select change strategies. Because I'm teaching people who have typically no psychology background, the go-to theory of change that we most often use is called the COM-B, capability, opportunity, motivation. Do people know? Is this one that's common in your field? No, maybe not. So this one, I use it because it's super simple. So literally, I have organizations, federal agencies that have told me you're not allowed to use the word theory when you come and talk to us. And so I kind of like circumvent it by not putting the word theory on the top of this slide, but I always bring a theory of change because we cannot create change if we don't have a theory of change. And so we often use this one because it's so easy for people to understand. It essentially says, in order for people to change, they need to be capable of change, so have the knowledge and skills. They need the opportunity to change, and they need to be motivated to change. And it is only when all three of those things are happening that we see change. In health, in education, in public health, we see lots of people focusing on capability, increasingly focusing on opportunity, and often neglecting motivation. And yes, I see a comment. John Main has written extensively about this. And there's a lot of great, in fact, I spoke to him several years ago about one of his great papers, specifically on using the COM-B. What we really like about the COM-B too, is it links out to a framework that unpacks different types of factors and reasons people might have barriers to change. And so particularly, it takes motivation and breaks it out into 8 different components, which we find really, really helpful. This is not the only theory of change. And I actually always tell people, if you have a theory of change that you like, that works for your initiative, that you are comfortable with, like use that theory of change. Typically, people who have psych backgrounds might use the theory of change that they like, and almost everyone else just wants to be told what theory of change to use because they don't have that background. And I wanted to flag that we actually recently released a tool to help practitioners literally map out their barriers and facilitators to select strategies. And so I can provide a link to that tool. It's free. Anyone can use it. It's in fact like thousands of people are using it. Strategies using behavior change theory, which is so exciting because that's not the norm, let's say, in implementation work in the field. When we think about the implementation, spread, and scale pathway, every single one of these buckets can in fact have several different frameworks that we use. So I'm just going to highlight, I think, 3 that are very, very, very commonly used and that we see evaluators use very often. The first one really helps us unpack readiness and context, specifically context. And it is called a Consolidated Framework for Implementation Research. It is the most cited implementation framework out there in implementation science. Originally written by Dan Schroeder and colleagues in 2009. They have a website, CFER.org, I think. And they have a newly published version, the CFER 2.0, that came out last year. This is used all the time. And it helps us think about what are the characteristics of the inner setting and the outer setting that impact implementation. So impact people's decision to adopt things, impact whether or not people are implementing well, whether they have fidelity, and whether or not they achieve outcomes. Note, this is our visual version of theirs because theirs is not the most attractive visual. And if anyone wants any of these visuals, they can just email and we can share them because people use them all the time. The next framework that is very, very, very commonly used, especially by evaluators, is called RE-AIM. This one, again, has hundreds of papers that have been published on RE-AIM. And it focuses on how there are kind of 5 different key components that you can think about when evaluating implementation initiatives. Did you achieve the reach that you were hoping to achieve? Was the intervention effective? What was the adoption of this initiative, this intervention? Noting that adoption is at the site or organization level, whereas reach is at the individual level. So like this might be like, how many social workers did you train? And adoption might be how many regions decided to participate, or agencies, or whatever unit you have of a group. They can look at implementation, which is about implementation quality. So things like fidelity. Did you have fidelity to doing the things that you were supposed to do? And maintenance is about sustainability. So were you able to sustain those outcomes? So this is very, very, very commonly used. I would say this one and the next one are pretty much the 2 go-to frameworks that evaluators use when partnering with implementation people and in planning their implementation initiatives. And the ones that we see, particularly if they're trying to publish in the implementation science literature. So my last one is called Proctor's Implementation Outcomes. And it disentangles the fact that often people think about client outcomes, they call them, or patient outcomes, as kind of the main measure of success, right? So did you have, improved client outcomes, child outcomes, family outcomes, patient outcomes? But it's saying we need to not only look at that, but also look at first implementation outcomes. Was the intervention acceptable? Did people adopt it? Was it appropriate? How much did it cost? Was it feasible? Was there fidelity? Was there penetration? Was it sustained? Once you know the implementation outcomes, you can then look at the service level outcomes like efficiency, safety, equity. Was it patient-centered? Was it timely? And then get to the client outcomes. And so people are often using this to build out their implementation logic models and then tying those to outcomes and indicators. Again, there are several different versions of this paper. And so it's really best to kind of Google it, find different options, particularly because if you're working in social work versus healthcare, you're probably going to want to find examples that link to your topic area. And there are definitely ones across lots of topic areas. My last quick notes in case, before we get to Q&A, if you are interested in more information on implementation, there's lots of kind of places to send you. One is we have this mini course called Inspiring Change. It's been taken by over almost 8,000 people around the world on like high level, what is implementation? And so it's a really, really easy way to introduce people to implementation science in about an hour and a half. And this is the event I mentioned about equity, this has been a really hot topic, is how can we really effectively embed equity throughout implementation? So all those resources are freely available there. Because we train lots of people, these are our two kind of foundational courses that map to those two pathways I talked about. And so these are more intensive, like full online courses for people that ultimately lead people to become certified implementation support specialists. So kind of a very specific role for people who want a job in supporting implementation. Related to jobs, the number one question at the end of last year was, from grad students, I would get 2 to 3 emails a week being like, I want an implementation career. Can you tell me how I get one of those? What do I have to do? So we put on an event. We had 1,300 people enrolled. We were like, oh, maybe we'll get 200 students. 1,300 people enrolled to find out about implementation careers. There are more jobs in implementation related roles right now than ever before. Every week we get people asking for people in implementation roles. Everywhere around the world. In fact, I just got 2 requests from Zimbabwe for recommendations. So like global implementation roles are happening. So this is an event totally free, and there's a bunch of resources if people want to take a look at those as well. And final thing, this is all the ways to stay connected to us. We're on Twitter. Oh, and we post jobs on LinkedIn. If you have implementation related roles, definitely share them with us, because people on our team post all of those to kind of help spread the word about implementation roles, which pop up every day.